एक second. I'm muting. Okay, I'm muting myself and starting the webinar. Rutuja?
Hello, hi, good evening. Welcome to AccuCheck Wellthy. Hello, Mr. Vinod. Good evening. How are you? I hope you're fine. Hello, Terkhedkar ji. Good evening. Thank you so much for joining today's session. Let's wait. We have a special guest with us today with a lot of learnings, lot of new things as promised for this year. Let's wait for all our AccuCheck Wealthy family and then we'll start with today's discussion, today's topic, today's live session. Meanwhile, I would love to know from each one of you what are our plans for the weekend. I think weekend is coming up soon. We would love to know, are you planning any cheat meals? Did you discuss about that with your coaches? Anything special you are doing over this weekend? Any changes, any kind of health routine you're following? We would love to know. Meanwhile, let's wait for all our users to join today so that we can discuss today's session. Hello, hi, good evening, Mr. Rao. How are you? I hope you are well, taking enough care of your health. Great. It's a special session today. I think many of you must be thrilled. It's normally on Saturday. Why is it that we have something on Friday? So, as given an update from your coaches, this year we are going to try and improve and work around what all can we provide you as a part of our sessions. And this is exactly one of it, a live session. I think many of you have requested this to all of us over the last few months, discussing on how exercising is important, how yoga, breathing techniques are important. And for all of us, whether you're on a weight loss program, whether you're on a diabetes management program, whether you are towards your hypertension or you are working on your heart health, we are here to help you. We are here to guide you, motivate you through these special sessions. So, wait for another 5 minutes, and I am 100% sure this session is going to be fruitful for all of us with a lot of new learnings. Hi, Suchitra. Good evening. How are you? Happy to have you as a part of our AccuCheck Wealthy family. I see you have joined today, and welcome to a special session on Friday, all about diabetes management, weight loss, and yoga techniques. Hello, Ashok ji. Good evening. How are you? I hope you are well, taking care of your health. Your blood sugars are under control. All right, let's wait for our members today. Thank you so much for joining before time. I think all of you who joined the session before time uh, not just motivate me, but my entire team and all our AccuCheck Wealthy family to ensure that we come up with new changes, special sessions for all of you. Hi, Nayan. Good evening. How are you? Thank you for joining. हेलो राकेश जी, कैसे हैं आप? Thank you so much for joining. I hope you enjoy today's session. All right, let's start with our discussion for today. I would love to know in the chat box if any one of you can tell me what is today's session about and who's our special guest. Great. Yes, you all are right. We have a yoga expert with us today. She is going to help us understand how health benefits us and what are the basic practices which all of us can do at home to control on our weight, our thyroid, our diabetes, blood pressure, heart issues, all of these things. So let's welcome Rakhi ji. Rakhi Kothari, a senior yoga expert who has dealt with more than 5,000 users, not just with basic yoga, but yoga with a holistic approach, wherein she has handled a lot of health issues, health concerns, and also practices on a day on day basis with more than 1,000 customers every week, every month. Welcome, Rakhi ji. I am very happy and welcoming you to this session for today. I hope all of us have a lot of learnings in today's session. Not taking up any more time, I can see you are ready with your mat, and I can see all our users are waiting to just ensure they join in with you and start our yoga. So, over to you, Rakhi ji. Please start your session.
Namaste, one and all. Very warm welcome to this yoga session, the practice. Um, it feels great to join you and to guide something on yoga. It will be my pleasure. So, without wasting much of time and without doing so much of bhashan, let's really start with the practice because we have very limited time, and in that particular time, I have to give you as much as I can. Okay, so I would like to request you all to sit in a comfortable broad base. Keep your spine naturally erect, do not hunch with your spine. Your hands are in Gyan Mudra. Gyan Mudra is just like, you are touching your fingertip, index finger and your thumb, and the rest of the three fingers are naturally curled and they're placed on your knees. Keep your eyes closed. Inhale and deep exhale. Try to connect yourself to the outer environment. Your surrounding. Of the room you're sitting in. No disturbance. And towards your back to the physical body. Gently touch the brain. Your gross physical body. Actually, now move your awareness towards your breath. Do not let it get your breath through. Just try to focus on your breathing. Count your breath. Inhalation and exhalation is 1, 2. Follow the natural rhythm. Do not manipulate. So,
Hello, hi Rakhi. I think voice is an issue. We are unable to hear you. We can't
It's
hear
not.
you, Rakhi.
Is it not clear, or is it lagging somewhere?
Now it's audible. When you're actually doing the session, it's a bit difficult
Okay.
to, yeah.
So I should be louder, right?
Yes. Louder or a little closer if possible.
Okay. And one more time, exhale with Om. Once you're done with 3 times of chanting, inhale, join your palms together, rub them rigorously, moderate the heat, and transfer this heat energy to your eyes and your whole body. You can touch your palms to your eyes, to your face, and your whole body. Once again, rub your palms together, generate the heat. Come onto your eyes. Gently open your eyes and look towards your palms. To begin with the practice, I request you all to stand up on your mats, come in standing position, and let's begin first with the joint revolution drills. So, okay, so you can lift your right leg up and start with ankle rotation like this. Okay, so your knee and ankle is in one straight line, your knee and hip is in one straight line like this. And start with ankle rotation. 1, 2, 3. Do not move your knees. 3, 4, 5. Now reverse. 5, 4, 3, 2, 1. Relax. Now lift your left leg up and we'll do the same thing with our left leg. Those who cannot stand on their leg, they can take the support of a wall or a chair. 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. Okay. Now we are going to do some knee movement. So you have to extend and flex your knee like this. So the movement is only from your knee like this. So let's start. 1, 2, be very gentle to your knee. 3, 4, 5. Change your leg. 5, 4, 3, 2, 1. Relax. Now let's start with some wrist rotation. Open your arms in the front and start with wrist rotation. 1, 2. Rotate only your wrist. Do not move your hand. 3, 4, 5. Reverse. 5, 4, 3, 2, 1. Relax. Now let's start with some shoulder rotation. So open your arms and go for the backward movement and then for the forward movement. Okay, so you're moving your arms back and then forward. Backward and then forward. So let's start. 1, 2, 3, 4. Be very gentle to your body. Do not make any harsh movements. Now we are going to reverse the movement from front to back. 5, 4, 3, 2, and 1. Relax. Now we are going to do some pelvic movement. So only pelvic movement will be done. So we are going to do some hip movement like this. Right? Push your hip back and forward. Now anterior pelvic tilt and posterior pelvic tilt. So anterior, posterior, anterior, posterior, anterior, posterior, anterior, and posterior. Now we are going to do the hip hiking, that is the thumka. So just give a thumka to the right and a thumka to the left. Right, left, right, left, right, and left. Do not make any movement from your knee. Okay, so now we are going to do some neck movement. So hands on your waist. So yes, you're going to do a circular rotation downward circular rotation of your neck. Do not move your shoulders. Okay, only neck movement. So go 1, 2, only downward rotation, don't go up. 3 and 4. Come in the center. Now go, take your neck up and go for upward rotation like this. 1, 2, 3, and I hope it's all clear to you all. So we are almost done with the joint mobility drills. Now let us start with some asana practice. Okay. So first, what we are going to do is Tadasana to give a whole body strength. So I request you all to interlock your fingers. Slowly take your arms up like this and stretch your whole body. And then gently you are going to lift your heels up. Okay. So let us start. Interlock your fingers. Inhale and take your arms up. Stretch your whole body. Gently raise your heels up. Be there on your toes. Focus on one non-moving point in front of your eyes and try to be stable out there. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Slowly bring your hands down. So this was Tadasana stretch. Gentle stretch to your whole body. Now, hip width distance between your leg and your arms are by the side of your leg. Now we are going to do the lateral bending. That is the side bending. Okay. So what am I going to do? I'm keeping my right palm on my right thigh and my left hand goes up above my head beside my ear. So my tricep is touching my ear. Okay. Now we are going to bend to the side. Don't go for the forward bend. See to it, they are doing the side bend. Okay. You have to weight. Your body weight is equally distributed between your legs. So bend sideways like this. Okay. So right palm on the right thigh, left hand goes up beside your ear, and you are bending on this side. Stay there for some time. 1, to feel the stretch on the lateral part of your body, left lateral part of your body. Left side, this stretch feel very. Slowly come back in the center. Take your left hand down and gently lift your right hand up beside your right ear, and your left palm is beside your left thigh. And try to bend to the left side slowly and very gently. Don't go for the forward bend, go for the side bend. Then you will feel the stretch on the right lateral part of your body. Distribute the weight equally on both your legs. Stay there. Keep breathing. Do not pull on your breath. Slowly come back. Relax. Now, for one asana, which is going to be Trikonasana. So for that, you need to bring a little bit 2 or 3 feet distance between both your legs. The inner edges of your foot are parallel to each other. So now we are going to go for the Trikonasana. Okay. So your right foot is facing the right wall. Your torso is absolutely in the front. Right foot facing the right wall. Open your arms on the sides. Now give a thumka to the left. Give a thumka to the left and slide your body to the right. As if someone is pulling your right hand. Someone is pulling your right hand. Yes, very nice. And then slowly try to come down. This is Trikonasana. Okay, don't go for this bend. Okay, so this was Trikonasana. So if you want, again, I'll instruct you. Open both your legs wide. Inner edges of the foot are now parallel to each other. Now we are going to take your right foot on the right side. Open your arms. Give a thumka to the left. Slide your body to the right. And then bring your right hand down and left hand goes up. You're looking up towards the left arm. If you're not comfortable here, you can look in the front also. If you're not able to grab your foot, your ankle like this, you are very good here also. This is also Trikonasana. So don't worry. Try to be stable here. Try to focus on your breathing. Keep breathing. Slowly come back. Now, your right foot is now facing the front wall and your left foot. Left foot facing the left wall. Now give a thumka to the right. Open your arms. and slide your body to the left, 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 as if someone is pulling your left hand, and then from your thumb, bring your left hand down, catch hold of your shin bone, left shin bone, or your ankle, or wherever you are comfortable. Don't try to overdo anything. Okay, so let's start. Left foot facing the left wall, open your arms, give a thumka to the right, slide your body to the left, slide, 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 and come down to the left side, and your right hand goes up. Look towards the right hand, upper hand is or in the front, and try to focus on your breathing. See to it that you're not hyperextending your knee. Your knees are soft. Slowly come back and release the slide, release the thumka back. Okay, now we are going to do is Veerbhadrasana 1. So you're standing on your mat like this, and you're taking your left leg behind. Okay, on your right leg is in the front. Try to sit on your right knee as much as you can. See to it that your knee and ankle is in one straight line and not going out of your knee is not going out of your ankle. Your knee and ankle is in one straight line. Left heel, अगर आपका उल्टा है तो उठा सकते हो, अगर आपका नीचे रहता है तो उसको नीचे गिरा सकते हो. So be comfortable in your own position. Okay, so try to keep your hip in the straight towards the right wall. Okay, so आगे वाले पैर का hip को पीछे धक्का मारो, पीछे वाले पैर के hip को आगे धक्का मारो. This is called squaring of the hip. And then join your palms up above your head and try to go for a slight back bend. Try to open your chest here and go for the back bend. So this is Veerbhadrasana 1. Okay, so bring your right leg forward, left leg back. Try to square your hips. आगे वाले पैर का hip पीछे, पीछे वाले पैर का hip आगे. Now try to sit on your right knee. Join your palms up. Slightly go for the back bend and try to open your chest here. बहुत gentle movement रखना है body का. Try to stay there and keep breathing. See to it that your arms are beside your ears. Slowly come back. Now take your left leg behind, right leg behind, and your left leg in the front. Now we'll do the same thing with our left. You're sitting on your left knee. आगे वाले पैर का हिप पीछे, पीछे वाले पैर का हिप आगे. You're squaring your hip. Join both the palms up. Inhale and go for this gentle back bend. Try to open your chest here. Keep breathing. Keep breathing. Feel the stretch on your back, on your abdominal muscles. Feel the stretch on your thighs. Feel the strengthening of your thighs and come back. Great. Now, what we are going to do, come in seated position now. Come in seated position and try to open your legs wide. दोनों पैरों को wide open कर देंगे as much as you can. Do not overdo or overstretch yourself. Now, what we are going to do is Chakki Chanav Asana. That is like this. Okay, so you're opening your legs wide. Try to pull your toes towards you. Very gently pull your toes towards your shin, and you're slightly tucking in your abdomen. हल्का सा अपने पेट को अंदर डालने की कोशिश करो. दोनों हाथों को इस तरह से लॉक करेंगे and try to make as big circles as you can. So inhale when you are in the center and exhale when you are making the circle, when you are going for the forward. Okay, so inhale up and exhale and make a circle. Inhale and exhale. Come on, let's do. So let's start. Keep your core engaged. That is tucking in your belly button. 2, 3, 4. Inhale up and exhale down. 5, 6, and 7. This is very much beneficial to reduce your belly fat, to reduce the thigh fat. Now reverse. 7, 6, 5, 4, deep breathing. Inhale up and exhale down. 2, 1. Slowly. Now bring your legs together. Bring your legs together. This is called sitting in Dandasana position. Keep your spine erect. Do not hunch or slouch. Try to be erect. Okay. Now we are going to do Nauka Sanchana. Like this. Okay. So what you are doing here is again tucking in your belly button slightly, and you are going to do the hip anterior pelvic. Okay. So anterior pelvic tilt. Inhale, exhale, and go down. And do this. Nauka Sanchana. 2, come on. 3, inhale up and exhale down. 4, keep your core slightly engaged. 5, come down as much as you can. A wonderful hamstring stretch for you all. 6, and 7. Now we are going to do the same thing but in reverse push. Like this. 7, 6, 5, 4, 3, 2, and 1. Slowly relax. Take some time to breathe now. Keep your eyes closed. Sit in the same position and take a break. Try to focus on your breathing. Try to raise your chest up while inhalation and drop your chest while exhalation. Inhale and chest is raised up. Exhale and you're contracting your chest. Inhale. Inhale. Now I request you all to lie down in prone position, that is on your abdomen, like this. अपने पेट के बल लेट जाना है. Slide your toes and your palms are by the side of the chest. Your elbows are touching your body. Shoulders are away from your ears. And inhale and have to lift your chest up in Bhujangasana. Okay, so now according to my instructions, we'll do Bhujangasana. Okay, so keep sliding your toes on the mat. Try to squeeze your buttocks a little bit. Okay, your elbows are towards your body, shoulders are away from your ears. Now inhale and lift your upper body up to your navel. That's it. And try to stay there. A wonderful stretch for your abdomen, for your chest, and amazing for your back muscles. It gives amazing strength to your back. Try to stay there for some time on my count and keep breathing. 10, 9, 8, 7, 6, 5, 3, 2, 1. Slowly relax. Now, keep your chin fixed on the floor. Make a fist. Now, something is disturbing. Can you please move them?
Yeah. Alan?
Yes. There are some voices coming, voices disturbance.
Yes,
I
yes,
think
yes.
someone is unmuted.
Yes, Rakhi. So I'm checking that.
Yeah. So now make fist of both your palms. अपने दोनों हाथों की मुट्ठी बनानी है इस तरह से. And tuck your fist beneath your legs. दोनों हाथों को अपने मुट्ठी बना के अपने दोनों thighs के नीचे रखना है. Fix your chin on the mat. Your chin is fixed on the mat, and you are going to lift your legs up in Shalabhasana. ठीक है, your knees are straight. Do not bend on your knees and you fix this. Your chin is fixed on the floor. Okay. So now, according to my instructions, make a fist of your both the palms. Tuck them beneath your thighs. Squeeze your buttocks a little bit. Now inhale and lift your thighs up off the mat. Your toes are up off the mat and your knees are straight. Chin is fixed on the floor. Very good. Very good. Amazing strength for your lower back. Stay there for some time. 1, 2, 3, 4, 5, 6, 8, 9, and 10. Very good. Now, I request you all to come into supine position, that is sleeping on your mat, on your back. You are on your back. So now here, try to bend on your knees. Try to bend on your knees. We are going to do the bridge pose. Again, strengthening for your back muscles, opening of your chest, stretch in your abdominal muscles. Okay? So what the pose goes like this. So here we are going to press our palms on the floor, squeezing our buttocks, giving a posterior pelvic tilt, and we are going to lift our hips up. Like this. Very good for your thyroid also. So try to bring your chest towards your chin. Try to lift your hip up as much as you can according to your strength. Now from here, interlock your fingers and take the weight on your shoulders and your forearms. Okay? So your knees are towards your buttocks. Your heels are towards your buttocks. You keep pressing the palms on the floor. Squeeze your buttocks. Inhale and lift your hip up, up, up as much as you can. Take the weight on your upper arms. Take the weight on your shoulders. Try to interlock your fingers and try to push your fingers towards your heels. Push your hands towards your heels. Try to be up, come up as much as you can according to your capacity. Do not overdo anything. Keep breathing here and hold this posture. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly come back and back. Both the legs straight on the mat. And we are going to do one gentle twist. Okay? So bend your right knee and place your right foot on your left knee. And open your left arm. And with the help of your left arm, push your right knee toward the left side. And your right arm is open on the side. And we are going to twist on this. Okay? So this is the supine twist. So keep your right foot on the left knee and with the help of your left hand, try to bring your right knee down on the floor and look towards the right shoulder. And give a gentle twist to your spine. Gentle twist to your abdomen. And try to stay there for some time. Try to focus on your breathing. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly come down. Straighten up your right leg and now bend on your left knee. Take your foot, lift your left foot and try to place it on the right knee. And with the help of your right hand, try to bring your left knee down on the floor towards the right side and your neck is towards the left shoulder. Try to give a wonderful twist to your spine and keep breathing. Do not overdo or overstretch anything. Do according to your body, your capacity. A wonderful twist for the spine makes the spine flexible and your abdominal organs are also toned. Slowly come back and relax. Now turn yourself to the one side, making a pillow of right hand or left hand and gently come up and go for the butterfly pose. I think this is a very common pose. You can sit in Bhadrakonasana like this and try flapping your knees on the floor. Now, here you can squeeze your buttocks slightly and try to keep your spine erect and chest open. Keep flapping, enjoy the flap, try to grab your toes. Keep your spine erect, do not hunch or slouch. Keep breathing. Very nice. Keep flapping. Very good for the hip opening, very good for the abdominal organs. Very good for the organs near your hip region. Now here you can squeeze your buttocks, squeeze your belly button in and slowly try to come down. Come down as much as you can according to your capacity. If you want, you can stay here and keep breathing. If you want, you can come down more. Inhale up and exhale down. So keep your spine erect, tuck your belly button in and try to come for the forward bend in both points. Wonderful stretch to your inner thighs. For those who are all sitting for 8 hours a day, working in office. So this is very good asana. This is very good practice to open your hip and to get rid of the negative thoughts. Because hip opening releases all the negative thoughts from your mind and from your body. All the negative vibes are washed out with this hip opening. Slowly come back. So now we are going to practice one pranayama. So you can sit comfortably either in Sukhasana or Vajrasana, which we always, I recommend you to practice it every day after your meals. After your meals, you can practice Vajrasana. So in Vajrasana, you are joining your greater toes and your heels are apart and your buttocks fit between your heels. And your spine is erect. Your both the palms are on your thighs. So you can sit in this position or Sukhasana for the practice of pranayama. So the pranayama which we are going to practice is Anulom Vilom pranayama. That is, you have to follow pranava mudra. Your index finger and middle finger are touching the root of your thumb, and your 3 fingers you are using to open and close the nostrils. Okay. So now we are going to close our right nostril. Your left hand is in Gyan Mudra, as I explained with the initial starting of the session. And you are going to close your left nostril. Inhale from the right nostril, and with these 2 fingers, close your left nostril and exhale from your right. You're opening your right nostril. Now inhale again from the right nostril. Close your right nostril and exhale from the left. Inhale from the right. Exhale from the left. Inhale from the left and exhale from the right. So we are going to do the alternate nostril breathing. So inhale from the right, exhale from left, exhale, inhale from left and exhale from right with this pranayama. Okay. So let us start. I think we should practice this pranayama every day for at least 5 minutes. That is very much beneficial for your internal organs, for your nervous system, for your breathing. It helps you to get rid of anxiety and stress. So whenever you are feeling stressed out or you are feeling nervous, you can practice this Anulom Vilom pranayama to get so many benefits. I cannot even explain how beneficial is this Anulom Vilom pranayama. Oh, not only for your physical body, but your internal body, for your mind, for your internal organs, and whatnot. So let's start with this Anulom Vilom pranayama for another 2 minutes. Inhale from the right. Exhale. Exhale. From the right. When you're inhaling, try to feel that your abdomen is growing, your chest is opening up, your shoulders are going up. And by exhalation, just feel that you're dropping your shoulders, your chest, and your abdomen contracts. So try to feel this by inhalation and exhalation. Just feel this and enjoy this pranayama. Anulom Vilom pranayama. And whenever you want to relax, you always need to complete the pranayama by exhaling from your left nostril. Because we start with inhalation from our right nostril and we stop by exhalation from the left nostril. Okay, so right nostril is activated and left nostril. So Ida and Pingla Nadi, that is the Surya Nadi and the Chandra Nadi. Right nostril is the Surya Nadi and left nostril is the Chandra Nadi. So we are going to balance both these nadis while practicing this Anulom Vilom pranayama. So the heat and the cold in our body is balanced. The sympathetic and parasympathetic nervous system of our body are controlled and balanced with the regular practice of this Anulom Vilom pranayama. 10 seconds more. Come on, continue with this pranayama. Now, you can relax by exhalation from your left nostril. Leave this pranayama after exhalation from the left nostril. Now, let's do some relaxation. Some relaxation technique. I'm going to tell you how to relax your whole body after the whole day of tiredness. And a quick relaxation technique is just lying down into Shavasana on your spine, like this. And before that, I would like to tell you all to raise your legs up straight. If you cannot, you can take the help of your arms or you can go with the support of a wall or a chair to keep your legs straight like this in Ardha Halasana. You can keep yourself legs straight and just stay there. See to it that your abdomen is going up while inhalation and exhalation, your abdomen is contracted. This abdominal breathing is really very much beneficial to get rid of all the stress. When you breathe from your abdomen, just see that paper boat is kept on your abdomen, and when you're inhaling, the paper boat goes up, and while exhalation, the paper boat goes down. Inhale and exhale. See the rise and fall of your abdomen. Inhale. Not manipulate, just follow the natural rhythm and follow the natural up and down. This is abdominal breathing, which is very much effective to get rid of any anxiety or any stress. Slowly bring your legs down, straight open your legs, relax your whole body. दोनों पैरों को थोड़ा सा open कर दो दोनों side में, दोनों हाथों को side में open करो. And deep inhale and deep exhale and relax your whole body. पूरे body को ढीला छोड़ दो and just relax. According to my instructions, you are going to relax each and every part of your body. This is Shavasana. Conscious sleeping and relaxation to your body. So bring your mind towards your feet and relax your toes, your ankles, your heels. Relax your calf muscles, your shin muscles. Relax your knees. Relax your thighs, the front thigh, the back thigh. Relax your buttocks. And relax your hip joint. Keep your eyes closed. And just try to bring your awareness now towards your arms. Gently relax your fingers. Relax your wrist. Relax your elbows. your upper arms, and your shoulders, your shoulder blades. These are absolutely relaxed. ढीला छोड़ देना है अपने दोनों हाथों को और दोनों पैरों को हम ढीला छोड़ देंगे और उन्हें रिलैक्स कर चुके हैं. Gently bring your awareness towards your back and relax your lower back, your mid back, your upper back, and your neck. Gradually now bring your awareness towards your abdomen. Flex your abdomen, your chest, and your throat. Now bring your awareness towards your facial muscles. Relax your chin, cheeks, lips, tongue, nose, ears, eyes, eyebrows, forehead, and your head. Simply relax. पूरा बॉडी रिलैक्स हो चुका है एंड आप ढीला छोड़ चुके हैं पूरी बॉडी. Feel the heaviness in your body, and your body is sinking into Mother Earth. Let your body drain. Gently relax your mind and try to focus on your breathing. Let the thoughts come and go. Do not let the thoughts make a home in your mind. Just let them go off. And try to focus on your breathing. Feel the gentle touch of incoming and the outgoing air on the tip of the nostrils. Feel the gentle touch of air on the tip of the nostrils. Feel that the incoming air is cooler and the outgoing air is warmer. Feel the difference in the temperature of the incoming and the outgoing air. Try to relax yourself here. Summing your mind. Focus only on your breath. Now gently feel the rise and fall of the abdomen. आपका पेट ऊपर और नीचे हो रहा है. जैसे आप सांस ले रहे हो, जैसे आप सांस छोड़ रहे हो, पेट नीचे जा. Feel the lightness in your body. Give gentle movements to your fingers and toes. Very gently move your neck right and left. But then close your eyes again. Now bring your legs together and take both your hands up and stretch your whole body. दोनों हाथों को ऊपर लेके जाएंगे कान के पास में and full body stretch करेंगे. जैसे कोई आपको ऊपर से खींचा है और कोई नीचे से. इस तरह से full body stretch देंगे. Inhale and stretch your whole body. Exhale and release the stretch. Now gently turn yourself to the left hand side, making a pillow of your left hand beneath your head and stay there for some time. Keep your eyes closed. Now slowly with the strength of your right hand, come up, sit in Sukhasana. Eyes are closed. And now we'll chant Om for one time. And we are done with the session. So keep your eyes closed once. Inhale. And exhale with Bring your right hand on your chest, on your heart. Place your right palm on your heart and give one simple affirmation to yourself. One simple affirmation to yourself. It can be anything, a positive affirmation that is good for you. Inhale and start with the affirmation. If you don't have any affirmation, I'll give you an affirmation. You can repeat in your own minds. I am healthy. I am happy. I am loved and I love everyone. You can repeat it one more time. I am healthy. I am happy. I am loved and I love everyone. For one more time, inhale and repeat. I am healthy. I am happy. I am loved and I love everyone. Join both your palms now, rub them rigorously, generate the heat. Now transfer this heat energy onto your eyes and your face. Gently open your eyes and look towards your palms, everyone, with a beautiful smile on your beautiful faces. And thank you, everyone.
Wow. It is not just our users who are happy with this session. Even my team, a lot of our AccuCheck members have also messaged. So great. I am really happy with your association with AccuCheck Wellthy. Thank you so much, Raki, for a practical session for all our users. Voice was a concern in between, but don't worry. We have a YouTube link available for all our users. And we will share that shortly with all our users as well. Let us see what are the questions for today.
Yeah,
Allow me a minute to check the message box.
sure.
Yes. So people are very happy with today's session. Raki, thank you so much. But
Thank you
because
so much.
this program is related more to weight loss and
Yeah,
related more to, diabetes management or controlling blood sugar levels, we thoroughly enjoyed, each and every activity and the sets which you discussed. But if you could highlight two or three certain set of exercises which are highly commendable for people who are diabetic or who have
okay.
high blood sugar levels or who need to lose weight as per their doctors. So, can you just show us one or two samples which are specific to diabetic patients?
Sure. So, diabetes is mostly related to insulin secretion in your pancreas, right? If I'm not wrong, I think, see, I don't have much knowledge about your doctors and all, but still, I would like to suggest one asan that is Manduk which you should practice every day. So, as I told you, sit in Vajrasan and make fist of both your palms like this. Your thumb is inside, okay? And you are placing this fist beside your navel. Now, with anterior pelvic tilt and slightly tucking in your belly button, inhale, open your chest out here and exhale and try to come down like this. Here, if you're not comfortable, you can place a pillow beneath your head, your forehead, and you can rest here. So you can practice this daily with an empty stomach for about 2 to 3 minutes. Let's start with 1 minute and then gradually you can increase your time. So this is one Mandukasana. And another practice that you can do is open your legs wide, straight. Your both the legs are straight open. Okay. Now inhale both the hands up with anterior pelvic tilt and slightly tuck in your belly button and try to come down. Try to come down. Try to touch your abdomen to your thighs. Don't try to first touch your forehead or your head on your legs. Okay. Don't avoid this practice. This will give hunch to your spine. So you are avoiding the rounding of the back. If you are not able to grab your toes, you can use a belt or a dupatta like this and try to stay here. When your hamstrings are open, when your back muscles are open, you can surely, slowly, and gradually come down. So this is also very effective for your diabetes patients. Okay, so these two practices I highly recommend for diabetes patients.
Great.
Okay,
Okay.
anything else?
Yes. Rakhi, we have a lot of females who are a part of today's session, and there are many of them who, due to their, daily routine, office work, home work, they do not get sufficient time. Like
Yeah.
spending an hour every day, or 45 minutes every day. So, can you suggest two, three quick things which anyone can do, at home on a regular basis, which will not say lead to weight loss, but eventually help them stay fit and active?
Definitely. While see, most of us, while we are working, we are almost slouching. We are always on your computers. We are always hunching our back. So, and to open, what our main target is to open our shoulders, to open the legs. So, hip abduction and the opening of chest. These two practices are very much essential. So, for that, I would recommend while on your chair, or you can practice this on your sofa as well. So, you have to keep your elbows like this, It's my sofa. So I'm keeping my elbows like this and your knees, and I'm on my knees, and try to stretch your whole body, whole shoulders like this. So it will give a beautiful stretch to your shoulders and also to your spine. So this will release the tension which we have caused here while slouching or while reading, while working at our workplaces. And another thing what I would say is every one of us are sitting like this continuously. So you can open your legs like this and try to go for alternative toe touch. 1, 2, 3. This will also help opening of your hamstrings and the abduction of your hip opening. This will help both the things, like opening of your hip. And another thing that you can do is interlock your fingers from behind, anterior pelvic tilt, and open your chest. ठीक है, ऐसे नहीं करना है. चेस्ट को ओपन करो और एक्सेल करते हुए धीरे से नीचे की कोशिश. ये देखो, मेरा हाथ तो ऊपर जा रहा है, लेकिन इट्स नॉट नेसेसरी सबका ऊपर जाए. सो व्हाट यू कैन डू इज टेक अ हेल्प ऑफ अ belt or a dupatta, and you can slowly come down. Again, try to keep the spine erect and elongate. Do not make round spine. Do not round your spine like this. It won't be effective. Okay, so try to keep your spine erect, and there you are. Also, some belt exercises or dupatta exercises that I would recommend is this. Just belt को इस तरह से hold करना है and try to open your chest and shoulders like this. आगे और पीछे हाथों को लेके जाना है. You can do it any form, while standing, while sitting, while just after your meals or something like that. कभी भी आप ये practice कर सकते हैं. Okay, so this was.
Yes, great. So we have a lot of users who are in the older age group, okay, who fall after 50, or in the age group of 50 to 60, 65, 70. It is difficult for them to do such stretches at a larger end, because they are diabetic. They have a lot of knee issues, body pain issues, and a lot of things specific to their health. So can you maybe just guide us on 2, 3 simple things which a person of senior citizen age group can do?
Yeah, definitely. So senior citizens, of course, they cannot sit on the floor. So they can sit on a chair like this. They can hold the chair. Left hand से chair को पीछे से hold करो, और right hand से chair को पीछे का जो back support है उसको hold करो, and give a gentle twist to your spine. This also can be done at office work, office times also. Okay, so ये twist कर सकते हैं. This is very good and effective for the older people also. Okay, and just older people को, they can just do some shoulder rotation like this. बैठे बैठे आप shoulder rotation भी कर सकते हो. Knee का अगर problem है आपको, so you can just practice sitting in chair pose like this. This will be very much effective for their quad muscles, for the strengthening of the quad muscles that can save their knee. Okay, so you're coming down and sitting on your like you're sitting on a chair like this, and your both the hands are up or straight or down. So this will help the strengthening of your quad muscles and save your knee joints. So many more practices are there. I don't know how to explain, and itni sari practices that I can help you out with. But definitely, if we are connected, I will definitely help you out with lots more asanas.
Sure, sure. So, for all our lovely AccuCheck Wealthy family, this is just the beginning, and we will have a set of session, a series of session with Rakhi ji, wherein we can take up specific scenarios and we can discuss as per time slots and our sessions for the webinar. Meanwhile, Rakhi ji, thank you so much for connecting with us today. It is great, and with we welcome you to AccuCheck Wealthy and hope to have a great association with you. For all our users, next week we are coming up with a special speaker, a lot of new information, but this was a special session based on all of your requests. Tomorrow we have something coming up which is related to your health, diabetes management, and ensuring you work on your lifestyle and your behavior. Stay tuned until tomorrow 6 p.m. we catch up again. Till then, take care of your health. Have a great evening. Bye bye. Thank you.
So much. Bye bye.